A very good morning. The topic for today's discussion will be on gingiva. Gingiva is a part of oral mucosa that covers alveolar process of the jaws and surrounds the neck of the teeth. It is divided anatomically into four parts: marginal gingiva, gingival sulcus, attached gingiva and interdental gingiva, as you can see in the picture. The marginal gingiva is also known as unattached gingiva. It is a terminal edge or border of the gingiva surrounding the teeth in a collar-like fashion. In 50% cases, it is demarcated from adjacent attached gingiva by a shallow linear depression, which is called the free gingival groove. It is usually 1 mm in width, forms the wall of the gingival sulcus, may be separated from the tooth surface with a periodontal probe. The gingival sulcus is a shallow crevice or space around the tooth bounded by the surface of the tooth on one side and the epithelium lining the free margin of the gingiva on the other side. It is V-shaped. A periodontal probe is used to determine the depth of the sulcus. The so-called clinical probing depth is around 2 to 3 millimeters. The attached gingiva is continuous with the marginal gingiva. It is firm, resilient and tightly bound to the underlying periosteum of the alveolar bone. The width of the attached gingiva is another important clinical parameter. It is the distance between the mucogingival junction and the projection of the external surface of the bottom of the gingival sulcus or the periodontal pocket. The mucogingival junction remains stationary throughout the adult life. Changes in the width of attached gingiva are caused by modifications in the position of its coronal end. The width of attached gingiva increases with age and in supraerupted teeth. The interdental gingiva occupies the gingival embrasure, which is an interproximal space beneath the area of the tooth contact. It can be pyramidal in shape or have a caul shape. In case of diastema, the gingiva is firmly bound over the interdental bone and forms a smooth rounded surface without interdental papilla, as you can see in the picture between the lateral and the canine. Moving on to microscopic features of the gingival epithelium, the three different areas can be defined: oral or outer epithelium, sulcular epithelium. Gingival epithelium is composed of the cellular elements. The predominant ones are keratinocytes. The non-keratinocytes includes the Langerhans cells, Merkel cells and the melanocytes. The non-cellular elements includes keratin, keratolinin, involucrin, filaggrin. As you can see in the picture, the gingival epithelium is composed of stratum corneum, granulosum, spinosum and the basal. The oral or the outer epithelium covers the crest and the outer surface of the marginal gingiva and the surface of the attached gingiva. It is keratinized or parakeratinized. The degree of gingival keratinization decreases with age. Keratinization of the oral mucosa varies in different areas. The sulcular epithelium lines the gingival sulcus. It is thin, non-keratinized, stratified squamous epithelium without retipex. It lacks granulosum and corneum strata. There is absence of Merkel cells. It has the potential to keratinize if it is reflected and exposed to the oral cavity, and the bacterial flora of the sulcus is eliminated. It is extremely important because it acts as a semi-permeable membrane through which the bacterial products pass into the gingiva. The junctional epithelium consists of a collar-like band of stratified squamous non-keratinizing epithelium. The number of layers increases with age. The cells can be grouped into two: strata-basal and suprabasal. It is formed by the confluence of the oral epithelium and the reduced enamel epithelium during the tooth eruption. The length of the junctional epithelium ranges from 0.25 to 1.35 millimeters. It is attached to the tooth by internal basal lamina and to the gingival tissue by the external basal lamina. The absence of type 4 collagen in internal basal lamina, whereas laminin is present. The junctional epithelium, which is attached to the tooth, is reinforced by gingival fibers, so both are considered as the dentogingival unit. The connective tissue of gingiva is also known as lamina propria. It consists of two layers: the papillary layer, which is subjacent to the epithelium, the reticular layer, which is contiguous with the periosteum of the alveolar bone. The gingival connective tissue is composed of cellular elements, which includes fibroblasts, mast cells, macrophages and the adipose cells. The non-cellular elements includes the collagen proteins and the ground substance, which includes fibronectin, laminin and the proteoglycans such as chondroitin sulfate, dermatin sulfate, heparin and hyaluronin. Moving on to the cellular elements, the predominant cellular element in the gingival connective tissue is the fibroblast. The non-cellular elements includes collagen, reticular and elastic fibers. The collagen type 1 forms the bulk of the lamina propria. The connective tissue of the marginal gingiva is densely collagenous, containing a prominent system of collagen fiber bundles called gingival fibers. It consists of type 1 collagen. The functions includes to brace the marginal gingiva firmly against the tooth, to provide the rigidity necessary to withstand the forces of mastication without being deflected away from the tooth surface, as well as to unite the free marginal gingiva with the cementum of the root and the adjacent attached gingiva. The primary group includes the dentogingival, alveolo-gingival, dentoperiosteal, circular and transeptal. The secondary group includes transgingival, intercircular, semicircular, intergingival and interpapillary, as you can see in the picture. The gingivodental are those on the facial, lingual and interproximal surfaces. They are embedded in the cementum just beneath the epithelium at the base of the gingival sulcus. The circular group, they course through the connective tissue of the marginal and interdental gingiva and encircle the tooth in a ring-like fashion. The transeptal group is located interproximally. These fibers form horizontal bundles that extend from cementum of approximating teeth into which they are embedded. They lie in the area between the epithelium at the base of the gingival sulcus and the crest of the interdental bone. The gingival fluid is also known as the circular fluid, which contains a fluid that seeps into it from gingival connective tissue through the thin circular epithelium. It helps in cleansing the material from the sulcus. It contains plasma proteins which may improve addition of the epithelium to the tooth, possess antimicrobial property and exert antibody activity to defend the gingiva. The main sources of blood supply are from supraperiosteal arteries, vessels of periodontal ligament and arterioles. The lymphatic drainage of the gingiva brings in lymphatics of the connective tissue papilla. The gingival innervation is derived from the fibers arising from nerves in periodontal ligament. A meshwork of terminal argyrophilic fibers, some of which extend into the epithelium. The Meissner type tactile corpuscles, crochet type end bulbs, which are temperature receptors and encapsulated spindles. Moving on to the correlation of clinical and microscopic features. Talking about the color of the attached and marginal gingiva is described as coral pink, which is mainly by the vascular supply, thickness and degree of keratinization and presence of pigment containing cells. The color varies among different individuals. It is lighter in blonde individuals with fair complexion than in swarthy dark-haired individuals. The melanin, a non-hemoglobin, is derived brown pigment. It is responsible for the normal pigmentation of the skin, gingiva and remainder of the oral mucous membrane. The size of the gingiva corresponds with the sum total of bulk of cellular and intercellular elements. Alteration of the size is a common feature of gingival disease. It is increased in gingival hyperplasia as well as in inflammation. The contour or shape of the gingiva varies considerably. It depends on the alignment of the arch, the location and size of the area of proximal contact, the dimensions of the facial and lingual embrasures. Generally, it is described as scallop pattern. The shape of the interdental gingiva is governed by the contour of the proximal tooth surfaces and location and shape of gingival embrasures. The consistency is described as firm and resilient. The gingival fibers contribute to the firmness of the gingival margin. The surface texture is described as stippling. Stippling is a form of adaptation and reinforcement for function. It is best viewed by drying the gingiva. The central portion of interdental papilla is usually stippled, but the marginal borders are smooth. The pattern and extent of stippling varies among individuals and different areas of the same mouth. The position of the gingiva refers to the level at which the gingival margin is attached to the tooth. When the tooth erupts into the oral cavity, the margin and sulcus are at the tip of the crown. As eruption progresses, they are seen closer to the root. The tooth eruption consists of an active and passive eruption. Active eruption is the movement of the teeth in the direction of the occlusal plane. Passive eruption is the exposure of the teeth by apical migration of the gingiva. The gingival recession is the physiologic as well as pathologic. The physiologic includes root exposure with the age. Pathologic includes excessive exposure of the root. Gingival sulcus may be located on the crown, cemento-enamel junction or root depending on the age of the patient and stage of the eruption. Thank you.